everyone here is familiar with Stat News, but if you're not, it's definitely one of my favorite publications. And yes, and it is though, and it wasn't born. It was born out of the Boston.
It started by the founder.
It started by the founder of the Boston
Globe.
Globe. That's right. So, but really fascinating articles, and no holds barred articles as well. So Rick Burke flew all the way across the country for us today. He's the executive editor of Stat News. So I'll let him kick this off. Thank you.
Thanks so much, Jill. Thanks, everyone. And I hope you all will go to statnews.com. We cover a lot of these disruption issues that are so important here. Everything from Watson Health to Amazon to a lot of the smaller companies around the world, really, and what they're doing with disruption in the future of health. And I'm thrilled to be here for this panel. The three people we have to my left, immediate left, is Amy Foley, who's Vice President of Product Innovation and Delivery, Johnson & Johnson Health and Wellness Solutions. And then next to her is Roy Jacobs, Executive Vice President and Chief Business Leader, Personal Health, Royal Philips. And Louis Levy, Chief Medical Officer of Teladoc Health. Now, I can't imagine a bigger story right now than what's going on in the world of medicine than preventive health and the technology. All you have to do is stroll around here and see all the array of products and that your companies are doing and that so many out here are developing. And it is fascinating to see the emphasis going from sick care to well care and to preventive care. And I wanted to first just ask each of you to mention to me sort of just look in your crystal ball and tell me one product that we all might not be thinking about, that whether it's from your company or somewhere else, that may be out there in 10, 20 years. Anyone can start.
Well, I think that in terms of preventive health, we see a lot in terms of connected devices. And I do think, following up on the last panel, that a lot of the future is really going to be around smart integration. So it's great to have, say, the Omron blood pressure monitor on your wrist. And I think that it is terrific because you can get a lot of in-app support as an individual. But when devices like that can become smart in the way that they are then connecting into care, that the individual might not even recognize that 170 over 110 is not an acceptable blood pressure, but that is alerting a clinical team that can do outreach for that individual, I think that is really turning the corner. And I think it is also getting a little bit out of the conundrum of the provider being confronted with your panel. My own background is practicing general internal medicine for 30 years. Your own panel of 3,000 patients and all the data that they can produce. It's really creating that layer of AI that can make a smart connection between individuals and their healthcare team.
Roy, let me ask you, is there a super duper toothbrush or something that's going to be out there in 10 or 20 years, or might we not need one?
For sure there will be, I think, an oral care solution. I think building on what was said, I think for me, probably the future out is personalized health, and in that I think technology enables to really get your personal dossier of knowing what is happening to you, and as a result being able to connect to ecosystems that can serve that. In oral health care, of course, we know that there's much more to it than just brushing your teeth. Systemic health connection is very strong. To get that understanding requires that actually it makes connection to different body parts and measurement of that, but also to what's available as knowledge out there. And I think that is what nowadays technology does enable much more, both on the data collection side and translating that clinically validated into a solution for you. Because I think what is important also in this prevention is that actually it's relevant for your personal state of affairs at any point in time, 24/7. And I think we are just at the outset of technology enabling a more personalized portfolio of solutions to people.
Amy?
Yeah, I guess complementing what my colleagues have said, it's less about a product and it's more about sort of this convergence of making sure these things are easy to use, right? And this push or trend toward value-based care globally, right? So as countries are dealing with the level of spend and we're pushing towards value-based care and you need people to be more adherent and you need them to do these things, which has a lot to do with integration, it has a lot to do with behavior change, and all of that kind of coming together. Whoever's successful at doing that, I think, are really going to be the leaders in the industry, and the products will evolve from that sort of perfect combination of those things coming together.
When you talk about easy to use, let me ask Louis, you've spent so many years as a clinician, how do you get physicians to embrace some of this new technology?
Right. So I think that we heard on the last panel about, the importance of the user interface. So I think that clinicians are people, and that I think that the shifting from asking people to receive data in multiple different forms can be very taxing over time. And I think that clinicians naturally love technology. We have technology in all aspects. We are scientists at heart. And I think that sometimes physicians perhaps can get a bad rap over being slow adopters because we have EMRs that were not particularly created with the physician in mind, and hearing all of the gripes around the dilution that has had in terms of doctor-patient interactions. But that's just one aspect of technology, the ability to easily pull up digitized images on one's computer screen, actually see lesions, digital pathology that Philips has advanced, are all technological advances that clinicians love. So when the technology is ripe and when the technology is mature, I don't think you have to do a lot of arm twisting to get clinicians to come on board. It's when it's not well thought out and when there are other stakeholders that the technology has been created for, other than the physician, that we get into this conundrum of you need to click that button, you need to click here, you need to click there, you need to associate the diagnosis with the treatment, and you get all of the friction from the physician community over what is essentially a very problematic user interface.
Would you all agree that clinicians are getting a bad rap?
Sure, yeah, they are. Sorry. But I think it's a challenge, right? And so it's the exact, I love the clinicians are people too, or humans too, right? It's the same thing we see when we see products that aren't being consumed the way that the designer might have envisioned them to be consumed by the average consumer, right? Because it's too difficult, it doesn't match with the workflow or the person's needs, and that's not different than I think that we're talking about here. And so in order for it to work and it to be used, it really has to match that.
And on a comparison basis, and I know this is sort of wildly generalizing, but physicians or clinicians versus patients. Roy, who's more of a challenge for you in what you're trying to do?
I would not call it as a challenge. I think a challenge is upon us actually to serve them better and actually make technology not a topic of discussion for technology's sake, but for what benefit is there for them. I think if we turn it more into an impact story and make it easy to use, I think we see adoption of patients as well as clinicians go up. It's much more about an open system that you need to kind of be part of. I think we also, as producers, as suppliers, need to think wider than our own product set. I think if you think about a health system, you need to collaborate. You need to take different pieces into account actually to make a holistic approach. So that also from a technology development perspective, data development perspective, we need to be able to actually facilitate that. And I think keep it as simple as possible. I think ultimately it should be an easy to use experience, and that is not only in kind of the interface, but it's also how it connects. I think the power of the data and how we actually can connect correlate them, actually turn them into the next set of knowledge and experience, I think that's something where we have to do a lot of work on the background as well.
How difficult, isn't prevention harder to sell because it's prevention and it's not right out there in front of you, and you're telling people you have to do this for your own future and your own health and well-being in the future?
I think it's hard to sell when you don't link it to the health outcome or to what the individual's sort of mission and purpose in life is. So when we talk about why people do things, it's hard to tell a healthy person that if you eat this or do that or exercise or do something else, you'll prevent something that they never imagined having, like a heart attack, right, or something like that. So that's just very unrealistic for somebody who's young, for somebody who's fit, who's somebody who doesn't have a family history, right? But if you put that together with, what do I want to be doing for the rest of my life, or what do I want to be doing right now, and kind of getting to that purpose and really focusing on what we talk about a lot at J&J, which is well-being, and how that really inextricably links both, from the data, but also just from the individual to, a health outcome that's desirable is really important, because otherwise it does become this thing that doesn't sound like something urgent.
Right.
Yeah, I think that often preventive care gets commingled with a greater sense of wellness, and I think that there's it's a more expansive term, at least in my mind. And I feel as though in terms of virtual care, it really has gone beyond the point of inevitability. We've seen a marked increase in individuals who are reaching out to receive virtual care, and what we see is like a patient that I spoke to several months ago who came to us with a little mild cough, a little bit of chest pain, a mild shortness of breath, and it was through ease of access that enabled this individual to have a very early diagnosis made of a pulmonary embolism that could have been life-threatening. So it was a way of preventing the sequela of multiple pulmonary emboli, because often one pulmonary embolus follows another if one is not promptly put on treatment. So I think that through clinical programs and technology, one can have preventive care in the sense of early access. And I do believe virtual care can really democratize access to great care. And I think that an important aspect of all of the connected devices is they are links, but the link that they have to link into is care that is compassionate, that is of the highest quality, that's cost effective, and that links back into the overall healthcare ecosystem. So it's not an oasis unto itself, but it's integrated into the total care of that individual.
And so I think it's also to point out what, again, preventive care is delivering to you. If you take an area which is extremely hot and you see that CS, which is sleep, preventive care in sleep is actually understanding what sleep does to you when actually you are deprived of a good sleep. And as such, making that a topic of discussion with the public, with the consumer, actually that raises their attention immediately. Who does not want to get more out of a short night of sleep? Who does not know anybody who's snoring that actually is in need of a solution for that because it's annoying during the night? But also we have sleep apnea, which of course is a very serious disease which needs solutions and treatments. So I think putting it into the perspective of what it does to you personally again, I think that's where the power of prevention is going to lie, so that people can really interpret it for themselves. So it's not a kind of for systemic health or for health in general, you should better do this and you should better, because people need to do already so many things. No, actually, if you want to perform tomorrow, if you want to be really at the best of yourself, then you want to have a good night of sleep, then actually you should better understand how you're sleeping and what you can do about it. I think those are correlations that can help people get excited about prevention. And luckily, I must say that if we see the area of healthy living and prevention, there's a huge, increase in interest. And that I think is partly also the consumerization of health, where people just feel more entitled and also want to take health more into their own hands. They don't want to leave it to others, and that's why actually they step up in prevention.
We introduce you all as from companies that are redefining innovation. in this area. Can each of you tell me something that you all are doing that the audience might not know about that your company is doing, or something that you personally are really excited about? Amy?
Sure. I mean, it's hard to kind of pick one thing. We're doing a lot of innovation work, but I think what really echoes some of the things we talked about here is with our health partner solution. So what we've done is take digital and innovation, and we've brought together this connected care set of tools around initially deployment against knee, hip, and bariatric surgery. But it gets exactly at all of the things that we were talking about, especially in the bariatric surgery space, where there's a lot of surround sound there for the individual as to whether or not they have the sort of social support to go ahead and take care of themselves. And so when we look at it, it's very fundamentally about care path adherence, but what it's really about is understanding people's mission and purposes in life and getting them to really want to do the right things and changing their behavior and sustaining that behavior change over time, which is always a difficult thing, right? We can all change behavior and go outside the door and do one thing one time, but we can't necessarily sustain that over life. And so when we look at that and we look at some of the pilot work we're doing with Penn Medicine, Princeton Health, and with Providence in Northwest United States, we're pretty excited about some of the patient work there.
Let me ask you one thing, Amy. I can't not mention that you are the 2017 Working Mother of the Year, and when you
Thank you.
So when you talk about your own, when you talk about people's behavior and your own experience, how does that bring to bear in terms of how you do your job?
So the first disclaimer on the working mom thing is when I told my kids, they told me that they didn't know how that could be because nobody asked them. So there you have it. At home, it doesn't matter. I think that for anyone, right, moms, dads, caregivers, et cetera, I think having that opportunity, and anybody can do this, right? You don't need to be a parent to do it, but having empathy for the individual is really, really important because, my colleagues here mentioned it too. It's so easy for us to get really caught up in what we want things to do and how they should perform, and if the person just does this, this, and this, it'll work perfectly. But you need to really put yourself in that situation, and if you think about sleep deprived and all these other things, those are you and me every single day trying to just get through. And so, right? And so if you've got to jump through all these hoops and you've got to ask a parent, my son has a lot of respiratory issues and he has an allergist and he has a pulmonologist. And at one point several years ago, I said, I'm done, I'm out, you're putting me in the middle. You two talk to one another and figure out what has to happen because you can't ask people to do that. And so when I think about those situations and I think about how hard it is, and we're in a place, where I live, where access is not an issue. But in other places in the world, right, access is a huge issue. And so you add that complication and the financial complications on top of that. That's why the topic that we're talking about today is so important, right? Because access globally and relieving that financial burden is so important for everybody.
No, I think building on, I think what I'm really excited about is how we are, and building on the topic of sleep, how we are using our in-depth professional knowledge, the clinical knowledge from serving patients over years, now to really kind of support consumers in their sleep needs. And those can be big and small. So I talked about everybody wants better sleep, but also snoring, which 40% of men do. It's a pretty big theme for many people every day. And a small technology innovation can make a real difference there. Of course, if you look over more serious issues over longer time, that kind of, also from a mental health perspective, what sleep deprivation can evolve into, I think we are looking at kind of how we can solve that in a manner that is relevant for an individual in their home situation, so that actually it doesn't become too intrusive, it becomes really relevant, but it is something that is clinically validated when we put it out there so that people can trust what is out there. And as such, you unlock new fields, and I think that is what the outside of current technology can do in these consumer health domains. We do the same in oral healthcare, we do the same in nutrition, we do the same in pregnancy and parenting. These are all fields that people have genuine big interest in. They're close to your heart. When you're a mother, when you're a father, you have a lot of questions that need to be answered. You want to have trusted partners that can answer them. You want to have somebody along on your journey. So I think that is something that we are very passionate about. Take that lifelong journey of a person and see where you can make meaningful interventions to improve people's lives, and put technology at work for the individual. And I think do that in areas where you have deep domain expertise, so that actually it's really differentiating and relevant.
Louis?
Yeah, so I think that in terms of things that people might not know about Teladoc Health, well, one is that we changed our name. We used to be called Teladoc, and now we are called Teladoc Health, and the reason for the name change was really to highlight the comprehensiveness of our services. So we started out as many a telehealth company as somewhat of a point solution. One might think of it as almost like a virtual urgent care. But with the acquisition of Best Doctors 2 years ago and Advanced Medical this year, we now provide a real virtual suite of services globally. And so I think that where we are really trying to distinguish ourselves as a company is not being a point solution, but be the provider of a comprehensive set of solutions that really span the population pyramid. So whether it's an advanced patient-centered medical home in the US, or whether it's a Canadian insurer that is using AI and algorithms to identify individuals on biologics that may need more comprehensive care, we are that solution out globally now.
Now that we've said all these positive things, we'll start with Louis. Is there anything you can point to that hasn't worked, that, this is all about experimentation and trying new things? Anything that, in terms of the area of preventive care, that just hasn't worked, or technology that hasn't worked, or a lesson you might have learned from that?
Yeah, I'd say the lesson that I've learned is probably a lesson that everybody else in the room already knows, and that is that engagement is tough. So we have a number of digital solutions that are really very comprehensive, and they're all geared towards allowing individuals the knowledge that they have access to Teladoc Health, either through their insurance carrier or their employer, and also a set of digital tools that are there to remind the individual in the moment of need, so that if the person might be waiting in an emergency room, having geofencing built into the app so that the individual knows, oh yeah, maybe I don't have to wait for 3 hours because I have a sinus infection, and maybe I could be reaching out to this organization. So I think that we are learning all the time. Millions of individuals globally have access to our services, but I think we're always iterating on that engagement strategy, which increasingly is turning towards digital tools to affect that engagement, because at the end of the day, one is only as good as the number of lives that you're actually able to impact. It's not just good enough that a person, quote, has access to the service. We really want people to be utilizing these services. And I think that we are seeing this, fortunately, year over year. So we track our membership and we track our utilization, and we're noticing that the utilization is really hockey sticking. It's really growing faster than the membership. So we know that we have, based upon our own data, as well as speaking to other folks in the field, that this virtual care really has passed that point of inevitability.
Right.
Yeah, I think in prevention, the learning we have is that you really need to educate and very proactively explain what a solution is about. So expect to put a product on a shelf and just it will fly out based upon a description on package. It's not the way how it works. So that requires a very different approach to content, to actually engaging, as was said. So some of the learnings also we are applying is now coming out of the gamification strategy and industry, where actually some of the visual representation tools that they use to actually excite people, get them into the games, we also can use to get people engaged into prevention, where actually we use tools that help people in easy ways to grasp the benefits of a tool. So that's something I think for prevention, we have a task at hand to really make it understandable easily, but don't forget that actually it does need work, and it will also take some time, and it will also take maintenance over time. I think where sometimes you can launch a product, you sell, and you move on. If you go into prevention, it's a lifelong task you engage in, a relationship you build, and lifetime value you want to provide. And that's a learning that we go through as a company as well.
Yeah, I think we all share similar thoughts on that topic, and I think from J&J, knowing people from the beginning of time to the end of time, it's a constant. We really rely on the behavior change and the data analytics to really test and learn, right? Because and things that we learn about from our consumer sector, things that we learn in pharmaceutical sector, and our medical device sector, and putting that all together, because you can have the best thing put together, but getting that engagement, getting people to really truly change that behavior. And so the ability to sort of see in real time how people are either using that product and engaging successfully or not allows you to pivot really quickly, because people's definitions of convenience over my entire career has always really sort of been one of the top three things I think that really defines engagement, right? And their definition of convenience can be very, very different at a certain point in time, right? And so in one case it might be not leaving the house, in another case it might be leaving the house, and so those are all things that you have to be able to keep up with and be ahead of. So.
One thing in our closing minutes, one thing we haven't talked about is the role of government in all this. And I was curious, one thing in the news this week is FDA Commissioner Gottlieb had mentioned the establishment of a new office to deal with cutting edge science and to help things like this, help spur new technology. And I wonder, without getting into, we don't know a lot of details about it, but is that generally a good thing or a bad thing to have government involvement in all this?
I think, for things like the FDA pre-certification program, which J&J was one of the 8 companies involved in, it's been great because we have a true partnership. The opportunity there is, I think sometimes when people hear government, right, they say, oh gosh, that sounds like a lot of regulation, and that sounds like things that would maybe inhibit things, but it's actually directly the opposite in the experiences that we've had, where the work is really to, in this particular piece, and hopefully will be with what you were just referencing, is on really better understanding what organizations have to bring to the table and bring to market, so that folks like us can bring solutions to market more quickly from a pre-approved status or from understanding the industry and the landscape. So I think in our experience, it's been very positive.
No, I think I would add that I think it's good that for new technology there is new expertise being brought in, also to government and regulatory affairs. We also strongly advocate that government is involved, especially if it concerns health issues, because it's a gracious good. What we would also advocate amongst governments is that they would align more, so that actually you don't kind of from border to border find different ways how they would look at things, because that does not, in a boundaryless world, actually allow consumers to experience as good as possible, as fast as possible, some of the innovations that we're putting out there. So that's a dialogue we are also having in similar way, especially with EU and US. We see them some moving into different directions that not necessarily is kind of beneficial for the health development.
Do you have confidence in where things are headed with the US and the EU and the...
No, we are engaging, and we are actually tabling it. We also see the government being open to address this. Of course, they entitle themselves to protect their own rights in their own environment, which is their role. But we see them encouragingly taking up the debate. They also see the challenge of it. They also want to bring regulation down where they can, and not necessarily kind of make it more difficult, but they also stand for their own practice, and they want to have their own judgment, which they are entitled to.
I think the role of government is huge. We heard earlier in the day, don't underestimate the power of the purse. And I think that as we think about remote patient monitoring and a whole host of other virtual services, reimbursement is going to directly influence innovation in that space. I think the role of government is also enormous in terms of privacy standards. So there's just so much great technology out there, digital assistants, voice, Alexa, that these devices are currently not approved in terms of PHI, but that's a huge role of government. I think also just in terms of provision of services, we have virtualists at Teladoc Health that are really excited to basically provide care across the country. And they can do that, but they first have to get 50 licenses. So this state-by-state licensure, I think, is archaic. And I think it's, again, the role of government to really take the lead in terms of that. And finally, I think just in terms of adopting standards around interoperability. We've heard a lot about interoperability, but it's usually an electronic medical record conversation. But I think that as there are more connected devices, it's going to be so important that as a consumer, that one can go to one site because one doesn't want to have 25 apps on your phone for the 25 different devices and things that you're monitoring. One wants to knit that together. And similarly, on the provider side, we don't want to have proprietary technologies that will preclude us from just being able to see what's going on with my patient. We want to be able to have that data displayed, even if it is coming from really a whole garden of different devices that are actually creating that data.
One final quick question, it only needs like a 10-second answer from each of you. As I was strolling through today, I saw one thing that caught my eye was something called smart shoes. And if you wear these smart shoes, you can prevent or identify Parkinson's and other diseases early on. If you're a consumer, and I don't know if that's a good thing or a bad, I have no idea, but if you're a consumer, there's so many things coming at you out there. What's your quick advice to people worrying about their health in the future and how they should react to all these things coming at them?
I would just say you really have to understand what's important to you because there's something for everything, right? And some of the applications are a little bit out there, but they'll come to center when people's needs, meet the technology that's out there. But I think if you know what you want to do, then it's easier to go from there and find the technology that helps you versus sort of surveying all the technology, which is what we're all doing here, right? Because we want to get ahead of that and then trying to fit it into your lifestyle.
Makes sense.
No, I think, get inspired. I think that's a great part of this show. Get educated about what's possible, but make the choice that's relevant to you. I think that ultimately is where it makes sense for people to opt for a technology solution that delivers a benefit that they're looking for, and that can either solve their biggest pain point or the biggest desire, and go with that.
Will's last word.
I think that if you have a good diet, a good exercise schedule, a good night's sleep, good relationships in your life, and meaningful life work that you've found, you can wear any shoes that you like.
Thank you very much for a great panel. Thank you.